Our enhanced skill training program at the University of Toronto is the largest third-year family medicine program in the country. We pride ourselves in selecting residents that are keen to learn the skills and knowledge required to serve special health populations.
So I think the Enhanced Skilled program in medical oncology is an ideal opportunity for a family medicine graduate because you can really combine both your family medicine training in looking at the patient as a whole with their family and the oncology training to make going through cancer diagnosis, treatment, and follow-up easier for the patient. The oncologist does see the patient as treating their cancer and moving on from there, and the general practitioner sees the patient and the family dealing with the other things that are going on through the cancer treatment. But a person who's been trained in both areas can really bring that together and make the transition through treatment and follow-up much easier for the patient, and I think that can be very rewarding for a clinician.
So doing a extra year of residency in medical oncology has been a lot more specialized than a general family medicine residency, so I'm not doing all of the rotations in the various subspecialties like emerge, obstetrics and gynecology. It's all focused on medical oncology and palliative care. It's a lot more independent, goal-directed, and you just feel like you have a lot more responsibility as the year goes on.
So for enhanced skills training, it's really important that the applicant is a very active learner, that they're very engaged and they really appreciate the learning atmosphere. It's important that they have good interpersonal skills because they spend a lot of time going through different departments and learning different avenues of medicine that they may not have been exposed to in their family medicine training.
I chose family medicine because I really like being a generalist. I like that I never know what I'm going to see on the way into the room. But there is a certain part of me that really enjoys being an expert in a subject area, and it's hard in some parts of family medicine to do that. So in sport and exercise medicine, I have the opportunity to have a very specific skill set and to be an expert in an area.
A clinician coordinator is needed to identify how and when to best use these players. And so the focus practice skills of the sport and exercise medicine doctor is in diagnosis, management, prevention of injury, and health coordination, as well as return to physical activity planning.
So throughout my residency, there have been a few things that I've done to make sure that I'm adequately prepared for this program in sport and exercise medicine. I've done a lot of sport event coverage, so working at big sporting events, taking care of the athletes on the day of the events. I've also done some research in the area of sport and exercise medicine, which is ongoing, and I've done electives clinically in the areas, shadowing certain doctors who work in this area.
Many of these leaders become your mentors, and this opens up opportunities to enrich your career in unique work opportunities, research endeavors, and involvement with elite athletes in professional teams or international travel and all kinds of sports. It's a pretty cool career.
So residents are evaluated through our program with direct feedback, of course, both from their ongoing supervisors as well as the patient. I also get a lot of feedback over the course of their year, and we meet monthly to review any feedback there. Also, of course, they're evaluated based on the ChemMed's competencies throughout their training.
So during my first year of family medicine residency, I did an elective at the Hassle-Free Clinic, which is a sexual health clinic in downtown Toronto. And I found myself that I really enjoyed working with the women there, counseling on their sexual health concerns. And after that experience, I actually was speaking to residents who had done the Women's Health Scholar program, and they said, well, why don't you consider applying to the Women's Health program if that's something you're interested in?
The competencies are based on the CanMed's FM framework, and so we're looking for people who will be medical experts in care of older people, but also have the skills in all of the other areas of CanMed's in terms of being good collaborators, communicators, be able to be scholars within the area of family medicine, and to demonstrate leadership would be some examples.
The best thing that I did to prepare for the Enhanced Skills program is probably just to make sure that I was really truly interested in the area that I was considering to do extra training. So I did several electives in geriatrics. I worked with different preceptors in various clinical settings, and all of this just helped to reaffirm my interest in elderly care, as well as confirm my desire to pursue extra training.
Well, we're very fortunate in Toronto to have tremendous breadth and depth both within family medicine but also the university as a whole. So we have the ability to provide residents with a very learner-centered program depending on their needs and their wishes.
So in the future, what I see for myself in terms of my career is having a blended practice. So I'd like to do both elderly care as well as a part-time family practice in the community.
Our residents become leaders, teachers, and change makers in an area of medicine that is both a focused practice and special interest for them.